Good morning, Mr. Speaker. My constituents are hearing about staffing pressures at our local hospitals, and they're very concerned. They're concerned that their loved ones are not going to be able to get the care they need when they need it. Under the previous Liberal government, we saw how the healthcare system was neglected, how hallway healthcare continued to get worse year by year, with no thought or planning for the future. Speaker, when I hear the government speak about innovation in this healthcare sector, my constituents want to know more about what we are referring to. Is it additional supports and new solutions, ideas to address the problems we have previously faced? Speaker, through you, can the minister please tell this House how our publicly funded hospital system is innovating to improve the patient experience?
The Minister of Health.
Thank you very much from the member from Flamborough-Granbrook. The short answer is all of the above. Ontario's hospitals are leading innovation in Ontario to transforming our healthcare system and improve the patient experience. Let me give you just one example that you would be interested in coming from your own community. Our government invested over $25 million to modernize and expand the stem cell treatments at Javinsky Hospital and Cancer Centre at Hamilton Health Sciences. The centre is one of 3 world-class hospitals offering all forms of stem cell transplants to adult patients here in Ontario. With this expansion, more patients will be able to access world-class cancer treatment sooner and closer to home, and they get that treatment they need where and when they need it. That's innovation, Speaker.
The supplementary question.
Speaker, I know my constituents in the Hamilton region are supportive of these types of healthcare investments. They realize more needs to be done and more supports need to be provided to our frontline healthcare workers and world-leading research centres. Speaker, my constituents have seen the news coverage and have personally experienced surgical delays. Going into surgery is a very difficult experience for many, but in Ontario, we have the best frontline healthcare workers who provide support through the entire process and act with excellence. Speaker, can the Minister of Health share with the Legislature how our government is investing in innovation to reduce wait times for my constituents and all Ontarians, giving them peace of mind and access to surgical procedures when they need them the most?
Minister of Health.
Thank you, Speaker. You know, we all understood that as the pandemic was at its height, there were going to be challenges related to surgical and diagnostic backlogs. So we proactively, again, worked with our hospital partners through a government fund of $86 million. The Surgical Innovation Fund, we are supporting hospitals as they develop the innovative solutions they need to continue to provide high-quality care and ramp up surgical capacity, reducing wait times and improving access to surgical services for patients. I think we all appreciate and understand that when an individual is going in for surgery, it can be a very stressful time. So anything that we can do as a government to smooth that opportunity and make sure that they get access to that surgery quickly is what we are seized at. At Hamilton Health Sciences, they've partnered with Niagara and Mohawk College to successfully develop the Operating Room Assist program. And because of a micro-certification program begun by our government, we will attract more health human resources, and they've already recruited the first 16.
Thank you very much. The next question, the member